a patient goes to a hospital, it's a skit, and now the doctor or the nurses, instead of calling them by name, they're saying, "Oh, now who you are."
What?
They're calling you what you're suffering from.
You remind me.
When I'm sitting with you like this, you can't really know what I'm going through. But then we are in a line. These are strangers.
Yes.
I'm only here for medical assistance, and now you're calling me by what I'm suffering
By
from.
the condition. In fact, I remember a particular one. We are gonorrhea.
I didn't want to mention that.
Hello, everyone, and welcome to Beyond Conditions. This is a channel that's centered around those of us who journey with chronic conditions towards supporting us, empowering us, and enabling this journey as we navigate the intricacies of healthcare. We do this in order for us to realize a fulfilled life and collaboratively with our caregivers and our healthcare providers. And today is a continuation of our previous episode where we were looking at the social determinants of health and the social dynamics and how this interplay in health communication. And I'm with my co-host, the beautiful...
My name is Marilyn, and as you remember, social determinants and dynamics in health communication, they are very important because they influence how information is conveyed and received between the patients and the caregivers.
Exactly. And the dynamics, remember, shape the interactions.
Yeah, they're interconnected.
Behaviors, yes, and the relationship. And that is why you may find the interactions are different in a social media WhatsApp group. The interactions are different between relatives and friends. And this may also be different, and there may even be tension between a doctor and a patient.
Tension?
Yes.
So what kind of patient health provider relationship is that?
It actually it mostly comes with tension because remember the doctor is an authority, and you are at a sort of diminished level because you are there to seek help, and so if messages are not conveyed in a clear manner, if communication is not done in a respectful manner and in a way that you understand, a lot of times it may be either wrongly perceived or misunderstood.
But what if I understand what the doctor or the healthcare provider is saying, but I have trust issues, maybe due to my past experiences with healthcare providers or the person I'm addressing as of that time? Can that also impact how I receive the information?
Yes, and it's important for the medical provider in this particular instance, as soon as you pick out that the patient, because remember you're doing active listening, so you're asking questions as you're communicating to ensure that this is clearly understood. You may even ask questions and you're engaging your patient.
Follow-up questions.
Yes, yeah. So when there are trust issues, and these do arise sometimes, then take time to clarify and to build trust. So this you do by being respectful, by validating their feelings where it is that maybe they had been gaslit before.
Or maybe my beliefs.
Yes, yeah. Or their cultural beliefs and their personal values.
Yeah, and then sometimes you even perceive them like they are not competent enough. So you really have to prove your worth for me to earn your trust so that I can trust whatever requirement or condition you're giving me.
Yes, correct. Yeah, so for the healthcare provider, especially that and this is a transactional relationship, and you're in a position of authority. So in this particular instance, the onus is on you to be the bigger person and ensure that the messages are communicated. The communication is such that it's clear, it's well understood, and it's respectful of the person's culture, personal beliefs, and religious values.
But Trish, I think empathy is also important, and they should also have good communication skills, because you might be saying something that is right or correct, but how you're saying it or the manner in which you convey the message puts me off.
And you remember, I think this must have been in our first episode where we were looking at the foundations. We spoke about the nonverbal cues. Yes, so these skills they will encompass all that. Because if you speak and you're speaking in such a way that your tone is poor, you're gesticulating wrongly,
and
you're pointing fingers, you patients need to remember.
What are the nurses in Kenya known for?
For sneering.
Rudeness. They're known for being rude.
Yes.
So right from the start, before I even get to the hospital or wherever I'm going, my attitude or perception of them, I'm already biased because these people are always rude. So I'm also coming with an attitude, knowing or unknowingly.
Yes.
We're not meeting on a neutral ground.
Exactly. And especially now that this is common knowledge, it's important for the nursing fraternity to seek to change perceptions of the public. And I have seen this, I've experienced this when I have been to hospital. I think I've mentioned here before, a particular nurse, Jacob. A nurse Jacob in Empisha, and his male. Let me tell you, this is one nurse that made me feel so cared for, and I hope that Empisha, wherever you are, you can appreciate this nurse. I even remember also a nurse, Angela, at Avenue. And there have been different other nurses, but there are some that come to mind very quickly because of how caring, empathetic they were of my situation. And they remember that I'm not here because I do not have a place to go, but I'm here because I'm looking for support owing to the fact that I'm not well. So they were empathetic of the situation. Remember, there's no patient who is here because they didn't have a date or they didn't have a home to go to. No, people have other activities to do, but illness has brought them to hospital. And sometimes even illness won't bring you. So when you see a patient who's come to hospital, appreciate the fact that they've even come in the first place. Yeah, sometimes we don't come. Sometimes we just die at home. Yeah.
Putting it like that makes me feel like maybe we're saying we're doing them a favor by going to seek medical assistance. It's your health.
They are serving us. They're not there as friends. They're also there to serve us. But that service should be done in a way that, promotes patient-centric service and management. They should uphold customer care tenets.
Okay, talking about customer care tenets. What if a patient disagrees with the medical plan or advice they're being offered? For example, maybe you have a medical condition that requires you maybe to get some parts of your body cut out, or maybe sometimes people are recommended for chemo. So how is this an issue? Can I disagree to a medical plan? And
oh, yes. And case in point, I remember when I had an appendix inflammation. I think it had ruptured by the time I went back to hospital. I went to hospital the first visit, and I was having a very bad stomach
pain.
ache. Pain, a lot of abdominal pain. And the doctor immediately advised that I be admitted. And I didn't want it at all. I mean, I have been to hospital so many times, and I was like, again. And I even questioned the doctor, and I was like, what will I be doing here that you can't do for me? Should I go home and come back tomorrow? And immediately after, the doctor, on realization that this was something that he felt should be taken care of as an inpatient, and I was refusing the advice, asked me to sign an against medical advice form.
What's the importance of that form?
Because it then communicates that you have been duly advised and puts on record. It's a document. You're documenting.
In case something goes wrong.
Yes, you're documenting that this patient was duly advised by this patient for whatever reasons. It could be personal beliefs. It could be that, And also remember, medical service is not for free in Kenya. So there are instances where I really want to have this service, but I can't afford it.
Yeah.
In such an instance, you can't say that I refused. Yeah, so these are the dynamics that you need to put in mind. And next time we will be talking about the socioeconomic factors. Yeah.
But it's possible for you to disagree to a medical plan.
It is possible for you to disagree to a medical plan. It's possible for you to say no to a surgical procedure. And also remember that a surgical procedure means that they will administer anesthesia. There are people who outrightly say no to anesthesia for whatever reasons, because of, especially because of the risks that come with it.
So you prefer to be operated on while you're still awake? They
No,
just numb you or what?
No, anesthesia comes with risks, including you may not wake up. So the doctors will advise you, and you have to sign a consent form before any surgical procedure. Yeah, so that is why it's important to fully inform the patient, to build their literacy where you need to. And we talked about health literacy. Yeah, and to make the communication very clear. If you need to speak in a language they understand, then please do so. Don't speak to them in English if they better understand
Swahili or the local language.
Yes, the local language. So communicate in a way that the patient understands and ensure that the message has been understood. Yeah.
But sometimes you find that the reason they are disagreeing to is important, or they're just anxious because they maybe have a bad experience or a bad example of the same thing, or something that somebody else went through and it didn't turn out well or right. Now, is there a way that the caregivers can maybe ease the anxiety, or for example, me disagreeing to a medical advice again because of my cultural beliefs? There are some churches that prevent people from seeking medical assistance, maybe.
Yes, you're
because
right.
you have to have faith, you'll get well. So they don't even go for things like vaccines. You can't seek medical assistance when you're sick. You can't. So is there anything that can be done about this other than literacy?
Well, ensure that first you've articulated the communication well. Like you've clearly pointed out the implications and the benefits of this thing, and even the risks. And then the other thing is you want to, and this is where empathy comes in, you want to understand where the patient is coming from. If they have had a previously bad experience, validate their feelings and their concerns. Come to their level, and thereafter be able to bring them to a place where they see there's trust. They see to it that I'm dealing with a different person who understands how I'm feeling, who is able to translate my feelings into words. Yeah.
So trust can play a very big role here.
Yes. Yeah. So build their trusts, understand where they're coming from, validate their feeling. If there was a cycle of gaslighting, this is the point where you need to stop it. Yeah, don't continue what a previous medical practitioner did in gaslighting a patient or invalidating a patient's concerns and feelings. Yeah.
Okay, so and then last time we also talked about gossip, and I couldn't help and wonder how it leads to stigma and discrimination and the role they play in healthcare communication.
Okay, so in healthcare communication, and when you're talking gossip, I would like to look at it both in terms of gossip within the healthcare providers, and I'm talking the doctors, the lab people, the nurses, the ones who even leak out results of people here and there. And I'm also talking about, we're looking at gossip within the context of those of us in society. Yeah, friends, family, support networks, and all these other people, just society as a whole. Gossips, the real vice in gossip is you are actually communicating with the intention to shape perceptions. Like, iyo gonjwa yake ni mbaya.
Yeah, gossip has a lot of misinformation.
Yes. So this not only, and I would like to retaliate this particular point, not only infringes on a person's right to privacy, it's against their consent. Yeah. You do not have permission to spread this information about them. Yeah. So by shaping people's perceptions about someone because of health information you have about them, which you're passing on without their consent, you're really just committing a deep vice. And you're likely to perpetuate discrimination and stigma.
Yeah, there have even been skits circulating online where you see a patient goes to a hospital, it's a skit, and now the doctor or the nurses, instead of calling them by name, they're saying, "Oh, now who you are."
What?
They're calling you what you're suffering from.
You remind me.
When I'm sitting with you like this, you can't really know what I'm going through. But then we are in a line. These are strangers.
Yes.
I'm only here for medical assistance, and now you're calling me by what I'm suffering
By
from.
the condition. In fact, I remember a particular one. We are gonorrhea.
I didn't want to mention that.
And then everyone, and
then
we
they're
all
looking at you, msichana mdogo umetoka swende
umetoa
wapi?
wapi?
I'm like,
Exactly.
I've come here for help, not judgment.
And the perception we have is that a sexually transmitted disease implies sexual immorality on your part as a patient. Not knowing that you may be in a perfectly healthy relationship where maybe the other partner strayed. And now you have. And that is what actually brought us to where we are with the HIV scourge. Yes, but you are just continuing discrimination, and refer to patients in an anonymous manner. Use numbers or use names where
just call me
it
by
is
my
allowed.
name.
Yes, yeah. Otherwise, most hospitals will call you by a ticket number. Ticket number 6, ticket number 10. Yes,
No, most of the time, you just get called by my name.
Yeah, I have heard many hospitals, and this is quite it's a recent trend. Ticket number 5, proceed to counter number 1.
Sometimes they say that ticket number 5, and then the look they're giving you after when you go to pick up your ticket or when you stand up to walk to where you've been called, the look they give you, it's just like, oh, are they judging?
Non-verbal cues.
Yeah.
Non-verbal cues.
You can even trip on your own leg and there's nothing there in front of you.
Yeah, non-verbal cues. Remember, you're communicating not only with your words. In fact, the words are only, like we said, 7%, but you're also communicating with a tone. You're communicating with your facial expressions,
gestures,
with your body gestures, and all these things. And even how, you want to lean over. It's as if you're towering over someone.
And then I think it's so disrespectful. And as for the patients, it discourages you from seeking medical assistance or being open with their care provider or health caregiver.
Exactly. So these are the things that you need to consider. These are the things that you need to have in mind as you're continuing the communication, and as you're especially doing it from the community networks, which in this case we're talking about the healthcare providers, the caregivers,
even
at
our
the same
friends
time,
and colleagues.
our friends, yes,
that's my story
colleagues.
to tell. Even sometimes they mean well, but it should be my story to tell, not you telling it on my behalf.
Yes, and seeking to shape perceptions. Yeah. So I don't know if we have exhausted the issues on today's.
Anybody with anything they feel that we've not addressed enough,
yes,
we are always open to replying to the comments, and your input is really valued.
Yes, your input is valued, and we appreciate that you continue to engage with our content. Remember to subscribe to our content, to share, to comment, to like. We have started the conversation. We want to see this conversation continue to a place where we seek to change society from how we communicate on health matters.
Because information is power.
Yes, and I think, as we said last time, society matters on health matters. So society matters on health matters. And we have been happy to engage with you today. I've been your host, Trish Barasa.
Marilyn Josephine.
Yeah, we'll see you again next time. Bye-bye.